So, Nunkari Nungi, everyone, welcome. My name is Professor Paul Worley. I'm Executive Director of Clinical Innovation here in the Riverland Academy of Clinical Excellence. Speaking to you today from Coorong, Murray Bridge on Ngarrindjeri country. And healthcare education's been part of this country for 60,000 years. And we are building on that heritage of Aboriginal engagement and leadership, and we acknowledge that we're building on that heritage and thank elders past, present and emerging for the contribution to our community that they continue to make. You would all be aware that the first 100 days of a person's life are considered incredibly important. COVID also reinforced the role that breastfeeding plays in transferring immunity to young children. And historically, I guess that whole area has been seen as very much women's business. But is it more? Is this something that it actually does take more than just the dyad of mother and child to have successful? That's the topic that we're looking at today, and we're very privileged to have Dr. Felix Ogbo, who is a general practice trainee and also a PhD public health scientist who has looked into this in the way that we prefer, which is to do this through research. And Felix, welcome to our Grand Rounds. We look forward to hearing your presentation and the opportunity to ask questions and have some discussion at the end of this round. Dr. Felix Ogbo.
So thank you, Paul. Thank you, everyone. So today I will be just presenting on something that I guess I have looked at in the past close to 8 years now. And this was in relation to the birth of my first daughter and some of the difficulties I experienced at the time. And of course, at the time as well, I was doing a few studies on this subject. So I think I might have my boss here, Dr. Kingsley Ogbo. He taught me everything I knew today about breastfeeding. He would be, I think he's joining from Sydney. And also one of my PhD students, who is now a very close friend, Kedil, is also joining from Orange in New South Wales as well. So these are good friends, good colleagues, and we've looked at this subject across the world and published a lot of papers on this subject as well. So thank you, everyone. Thank you for joining. So I just want to start off this presentation with a prologue and just to kind of bring to our awareness what is happening in the space of breastfeeding. And this was a post, an article from the New York Post, and it talked about men now drinking human breast milk to get ripped. And we know for almost a decade now, if not more, that we have adult men who now drinks breast milk just to, number one, either boost their energy or build their muscles or prevent infection. Around the world, in some countries, we know that about a liter of breast milk sells for about 100 Australian dollars. Of course, you know, this story might seem funny and quite weird, but I guess it underscores the importance of what the human breast milk does. In Australia, the Daily Mail reported in 2017 that it is called the white gold because mothers are now selling their breast milk for up to $500. The price is often dependent on who is buying the breast milk. For men who are into juju, which of course juju means, you know, talisman, people who kind of deals with charm Juju is another name for fetish or talisman from some part of Nigeria. You find them paying more for this white gold. As part of our introduction, really, appropriate breastfeeding is essential for not just the baby, it's also good for the mother, the household, and the community. And there are a lot of areas where, if you want to look at what optimal breastfeeding is, but we restricted ourselves to involve breastfeeding in relation to timely initiation of breastfeeding, which is breastfeeding within the first 24 hours of birth, the duration of breastfeeding, which is up to 2 years, and exclusivity of breastfeeding. In the literature, the benefits of breast milk or breastfeeding to not just the baby, but to the mom is well documented. For the baby, we know that it's very important in preventing diarrhea and or upper respiratory tract infection. It helps in preventing obesity. For the mother, there is evidence that it improves or prevents breast cancer. It helps also in bed spacing that we know for a long time now. In many countries, we have seen this, and this is something that is also improving on a daily basis, where there is a shift. I think Paul alluded to this earlier when he was providing his introduction, that there is now a paradigm shift from women being seen as only primary caregivers of young children. And of course, there is also an impact on gender role differentiation, where at the time where my first daughter was born, the institution where I was working provided me with 2 weeks of paternal leave. And the idea behind that is to kind of provide me with that support, to provide that assistance at home, given that we now have a new baby. And of course, some of the assumption at that time would be for me to provide that additional assistance to help in that infant feeding period. And we've observed that in many communities around the world, that there are many actors, both in the hospital, at home, in the community, that can influence infant feeding decision within the household and the community. And when you bring that to research globally, we have seen that there are a lot of research that has been conducted that has found that husbands, partners, grandmothers, especially in Asia and Africa, that the decision of the mother to initiate and continue breastfeeding, also with premature cessation of that breastfeeding, is often influenced by some of these actors as well, not just from the hospital, which of course the prenatal and postnatal nurses do very well, but some of these actors outside of the hospital tend to play some very significant roles. In Sydney, which was where I lived for a few years, which was where I did most of my research at the time, we found among Australian women and those from culturally and linguistically diverse population, their partner support was important in ensuring that women provided appropriate breastfeeding to their children. But what was missing at the time was, when we say that the partner provided support, what type of support did the partner provide, which was something that we were interested in this particular study. Not just, yeah, my partner supported me. Well, that is good, but as researchers, we wanted to drill that question in detail and to find out what was actually the reason behind those improved breastfeeding outcomes. And we know across various studies that when you involve not just the mom, but you also involve the partners, you also involve the potential father in decision-making around infant feeding, especially in this case, breastfeeding outcomes tends to also improve as well. So again, our aim at the time was to systematically examine the impact of the specific type of partner support in relation to, one, breastfeeding initiation, the duration, and also the exclusivity of that breastfeeding as well. So As part of our methods, we use the PRISMA guideline, which is often a more robust way of reporting studies. And we looked at published studies at the time to determine the type, which I want to emphasize that the type of partner support, not just my partner provided some support. We wanted to know the specific type of partner support in relation to breastfeeding initiation, the duration, and the exclusivity of that breastfeeding outcome. We looked at 7 databases, and this included Scopus, the Web of Science, PubMed, and out of all of our set, we were able to obtain around 695 studies, and out of that, we were able to retrieve and assess about 7 studies that met our inclusion criteria. We use the PRISMA guideline, as I said, and this is the flow chart that we use, which is publicly available that one can also look at as well. And we arrived at 7 qualitative studies for assessment and analysis. This is often very important in definition of terms in the study. Who did we consider as being a partner or a father? That person could be the husband or the partner of the new mother, or the father of the infant whose breastfeeding outcome was measured. We define breastfeeding initiation as the introduction of breast milk to the infant within the first 24 hours of birth. This is WHO standard. We'll also consider breastfeeding duration, which was any breastfeeding up to 24 months after the baby was born. Exclusive breastfeeding is one of the key areas where we advocate for the provision of only breast milk to the infant from age 0 to 5 months. And of course, this also would include the provision of things like medicine, vitamin C, oral rehydration solution, especially in areas where children are prone to diarrhea. That also forms part of exclusive breastfeeding. What were our inclusion criteria? We were specific on this. We wanted studies that were peer reviews, dissertation books, book chapters. We also focus on articles that measure the specific type of partner supportive action, at least one of our study outcome. We wanted to consider only studies that were written in English, and the full text was available to us for assessment and analysis. Exclusion criteria, you could flip the coin and say studies that were published in languages other than English, those that were opinions that were not peer reviewed, studies that did not consider the specific type of partner support. For example, partner support was vague. We wanted to know the exact support that was provided by the husband or the father and or the partner. Also looked at the analysis, the quality of the studies that we found, which this is just the analysis of the methodology of the study that we used, and we used the NIH criteria for assessing our studies that we retained. So, given all of the effort that we've put in to look at over 100, close to 700 studies, and we arrived at 7 good studies that focused on these 3 outcomes. What were our results? So 4 out of the 7 studies found that partner support in form of verbal encouragement to new mothers increased breastfeeding duration and exclusivity. This was quite an eye-opener for us when we were looking at the evidence at the time. And in addition, we also found that the sensitivity of the partner or the husband or the father to the new mother's needs was also important in improving breastfeeding behavior, assistance in providing, in ensuring that there is that prevention and management of breastfeeding difficulty. It might suffice to say that in my time, while I was preparing this presentation, I had to, ask my wife, I'm like, going back to 2018, based on what happened at the time, what could you say was my type, my specific type of support at the time? And she kind of mentioned, well, yeah, you provided some assistance in managing the breastfeeding difficulties in the early days of the baby being born. And helping with household duties and childcare was something that we found that was also very important to mothers. We demonstrated that appropriate and specific partner breastfeeding support can influence a mother's decision to initiate and continue breastfeeding in the early postnatal period. We then argue that breastfeeding programs, not just in developing countries, but also in the Western world, should consider the involvement of not just the mom, but also the partners and their specific roles to maximize the impact of those interventions. And we consider some strengths as well, and limitations. Of course, for our studies, the number of available studies were limited to 7. One could say, okay, just 7 studies around the world, that's few. But of course, we would argue that when there is no data, it's very difficult to provide advice. So we advocated for more additional studies. And of course, we also consider as part of our limitation that we used studies that were only published in English language. Of course, that might be that we may have missed other studies that were published in Spanish or in other languages as well. But something that we thought of that was very crucial, even during the review period of this article, was, I guess, a suggestion that one of the reviewers highlighted to us was the cross-cultural generalization of the evidence, where we know that the mother's experience or perception of support from the partner may differ between and within countries and or between individuals. So what Mrs. A might see as support, Mrs. D might see that as, well, that is just routine. And of course, having those in-depth analysis of these areas, we believe that will provide additional information on this subject. Our strengths, we were able to show that specific type of partner support has the potential to influence the mother's decision to initiate and continue breastfeeding in the early postnatal period. Of course, in my own case, looking at the strength, my wife at the time has made a decision to exclusively breastfeed, so it was easier for me to just key into that and just provide that encouragement. Of course, our review, we believe that it provides additional and valuable insight into opportunities for improving breastfeeding programs. Now, to conclude, I want to, of course, we do live in a very beautiful country, Western world. I want to bring to our consciousness something that I think is important, and which is public breastfeeding. Why I believe, as an individual and as a researcher, that the partner and the father can play a unique role in the household to improve breastfeeding behavior. I think, and I believe, that the community must also do its part. And this is something that I read in 2023, where a judge, of course, in Melbourne, defended his decision to kick a mother out and the baby from the court, and because the mom wanted to breastfeed the newborn, and the reason was that it was going to be a distraction in the court of law. And my question to everyone listening today is, would you be offended by a woman breastfeeding in the public? Whether you say yes or no, that is an individual decision. The next thing would be, from my experience based on the research, is that public breastfeeding, the struggle, I think, is real. And a lot of the evidence out there is that most people would like to breastfeed, but there is always this conscious awakening that I think that people should have in relation to breastfeeding. And I think that would also improve things. In many developing countries, for example, in Nigeria, in Ghana, in Cameroon, all of these Asian countries, women will breastfeed in the marketplace and there won't be any issues. And I think, in my view, in my assessment from the research that I've done, this is a problem for the Western world. This is my reference. The study was published in 2019. My daughter was born around August, and that was when we started thinking about the study. Like I mentioned earlier, Kingsley Ago might be joining, and Kedil as well might be in this section. So thank you. Thank you for listening.
Thank you very much, Felix, and thank you for your co-authors joining us as well. What a privilege. While I wait for questions to pop up, please raise your hand if you have a question. I'll raise one, and that is, you at the end of your presentation, you started talking about the cultural norms and constraints around breastfeeding. If you take a critical realist approach to breastfeeding, there would be a number of actors that you can observe that influence breastfeeding, but there's also the real social structures that potentially aren't as observable, that are just as important. And I wonder whether you want to comment on that balance between the actors that you can observe and the behaviours that you can see that your review found, and the real social structures that may be influencing the breastfeeding uptake at the same time.
Yeah, I think the number one, there should be that awareness that it is a mother trying to feed a baby. And number two, the sexualization of the breast is something that I guess has become a common thing in our environment. And people forget that the primary thing of the mammary gland really is to provide milk when needed. But there has been a change in that perspective. So this is something that has been reported not just in Australia, but also in the UK, in the US, where even at the poolside, a mom wants to breastfeed, and that mom is shamed for just trying to breastfeed maybe a baby at the poolside. It's been widely documented, even for a mom in the UK, if I remember very well, who went to the restaurant to feed a baby, and the waitress came in and brought something to say, hey, please cover up. We want you to cover up so that you could feed your baby. So there are a lot of things that needs to be done, even though we know that the legal backing is there for women to breastfeed anywhere that they feel comfortable in doing that. But there is still, in my view, that cultural reawakening that needs to happen. Because a lot of people would see maybe a 25-year-old girl, in my view, half naked, up, no one will say anything. But if a mom wants to breastfeed, there would be, in my view, of course, that, oh, please cover up. And while I was preparing this presentation as well, and I was working in an emergency department, I just walked into the waiting room. Of course, a woman was breastfeeding there. I was like, oh, okay, this is nice, because she chose to do it there because she had, I think, 3 other kids with her at the time. So for me, I am aware that she should do it wherever she feels comfortable in breastfeeding. But for someone else, the next bloke sitting beside her might not see it that way. And the other thing I see is that in many regional Australian communities, it might not be an issue. So there is, based on the evidence as well, might be just that urban-rural type discourse as well.
Thank you. Are there any other questions that people want to raise while we're on the public forum? I know Felix and his collaborators would be very happy to have a discussion with people afterwards about the details of the research. While I'm looking for that, another question I had, Felix, was from your study, did you get any idea about the effect size of partner support in terms of breastfeeding? Are there any studies that have actually looked at measuring the effect size of those various, verbal encouragement, the sensitivity, the assistance with household and child management while the mum breastfeeds? Is there any evidence around that?
Yeah, so what we found was that our studies were, we found qualitative studies. However, when you put all of that into the umbrella of partner support, what you get is a relative risk of around 3.5. But there were no studies that looked at those specific type of partner support, which was something that we advocated for, to say we needed more studies to look at what would be the measure of these types of partner support. So our studies at the time were to bring to the fold what type of support, instead of just grouping all of that into saying partner support. So as I speak to friends of mine to say, oh, now you're expecting the baby, I think you should consider 1, 2, 3. It's different from you have to provide support. Yes. Because my advice now is now more specific. Even when I speak to guys or patients that I see, I always would say, you have to do X, Y, Z. And I remember in my personal experience as well, as soon as I drive from the university home, the first thing I do is to drop my bag. Regardless of what has happened, I'll just grab the baby from my wife, and then it continues from there. So it differs.
Yeah, it reminds me of the advice that we give people when they're giving feedback is be specific. And providing support is a little bit, it sounds to me like, well, you've got to do a better job, but not actually giving clear and specific guidance as to what that better job looks like. Kingsley, you had your hand up before. You're on mute, though.
I just wanted to add to what Felix has said. There's very limited study regarding the effect size. These studies are quite limited. From memory, there's about 4 or 5 studies that have done a kind of meta-analysis on this area. And it also differs by culture. If you look at most developing countries, people look at the role mother-in-law plays in terms of breastfeeding. But whereas if you're looking at a lot of developed countries, you're looking at partners. Even among migrants, it's quite also tricky, even among the Aboriginals. You see, some of we migrants, when our wife had kids, we bring our mother-in-law, they still want to dictate how. So there's a lot of issue around the, father's role. It's quite a new area. It's an area that, needs to be exploited a bit more. And in terms of cultural difference, it also varies among the Aboriginals as well. I mean, based on, I know Felix didn't know this, based on this research, we are trying to do a kind of pilot studies looking at the role Aboriginals father plays in terms of improving breastfeeding. So to see, looking at those cultural variability you talked about.
Thank you, Kingsley. That's very helpful. Our time is up. I'm sorry, we could, I'm sure, continue exploring this. And I think one thing that you have shown us in this research is that this actually does need far more exploration. And I think you've pointed out quite rightly that research findings don't necessarily translate across cultures and across contexts easily, which of course is why in the academy we are so insistent that there needs to be rural research to inform rural policy and rural practice for the betterment of rural communities. So thank you everyone for being part of this today, and thank you Felix again and your team for doing this research and sharing that with us to give us, next time we're asked for advice, we can be far more specific about what fathers can do to increase the chance that their child gets the best start in life through breastfeeding. Thank you very much, everyone. Nakan.
Thank you.